Good afternoon, and welcome to the Low Income Home Energy Assistance Program, LIHEAP, webinar. Today, we're going to talk about case management, approaches in LIHEAP, and the use of Assurance 16 funds. Our presenters today are Akam Raman, our Operation Branch Chief here at the Division of Energy Assistance, Josephine Rago Adia, the Program Specialist, Kate Thomas, Program Specialist, John Thompson, Auditor, Vicki Petlow, Program Analyst, Doris Calles, Program Specialist, Nancy Stevens, a Program Specialist, and Melissa Torgensen with Verve Associates. My name is Rich Lewis, and on behalf of DEA, we welcome you to the LIHEAP webinar. A few housekeeping matters before we get started. First of all, all participants will remain muted during the presentation. You can add any questions to the Q&A box for a response at the end of the presentation. We also ask that you turn off your camera and any other applications if necessary. And finally, your participation is especially appreciated during the grantee discussion. And thanks again for your participation today. Before we get started, I should give you a 30,000-foot view of the presentation. First and foremost, we're going to talk about the Health and Human Services Strategic Plan, our mission, and federal statutory flexibilities. Secondly, we'll talk about wraparound services and case management. Then a transition in our discussion will really focus on innovative case management approaches and how they are applied in social services fields. Fourthly, we'll discuss LIHEAP and the use of Assurance 16 funds. In addition, and this is my favorite part, we're going to have 4 separate grantee presentations on Assurance 16 and case management to give you examples from the field. And then finally, we're going to discuss how it is that we should evaluate the impact of Assurance 16. So once again, thank you for your participation today, and I'll turn it over to my colleague, Josephine Rago Adia. Josie.
Thank you, Richard. Welcome everyone in this afternoon's webinar. In this presentation, we are featuring case management as one of the approaches to LIHEAP household and the roles of social workers and case managers to help achieve the goals of LIHEAP. Richard, I think we need the first 2 slides. Thank you. The other one. Okay, sorry. I am glad that we're holding this webinar on the Social Work Month. This presentation is timely, and I would like to quote the greetings posted in our website, that the Administration for Children and Families honors and appreciates every social worker demonstrating their commitment to people in need in day in, day out. And thank you for all you've done and continue to do. It is the intent of this webinar to demonstrate that the case management approach could be useful to LIHEAP. Therefore, we encourage all grantees to adopt this approach by using Assurance 16 funds. As you know, it is not mandatory for our grantees to set aside Assurance 16 funds. But if they do, there are ways to effectively use this fund to help our LIHEAP household reduce their energy burden. Also, given the additional funds that we received this year, we encourage our grantees to allocate a maximum of 5% of the Assurance 16 to enhance their work with their household. There is a distinction between using Assurance 16 funds for energy burden reduction, financial counseling, and overall case management. The latter should be supported by a combination of funds, especially when working on other issues other than energy-related need. We also understand that its grantee and their local agencies may have different terms that they use to promote this approach. We appreciate our 4 grantees of grantee presenters this afternoon for graciously accepting our invitation to show us their different practices and the terms they use. I am now turning over the presentation to Akam Raman, Branch Chief of the DEA's Operation Branch. Akam?
Thank you, Jyoti, and good afternoon and good morning to some of you. I must start with a huge thank you to Jyoti and our team members for putting together this wonderful presentation that you are about to observe this afternoon. This Assurance 16 webinar actually started as a special project within DA about a couple of years ago. So I'm really excited to see that special project come to fruition as a TNTA webinar. So you will learn about Assurance 16 in greater details. You will see some connections between Assurance 16 work and case management. And finally, we'll be hearing from some of our local agencies real life noteworthy practices about LIHEAP and Assurance 16. The connection between Assurance 16 case management and HHS goal are pretty obvious. We are in the business of helping our households across the country, especially low-income households, particularly in LIHEAP, to provide them with highest possible amount of benefit to households with lowest income. That theme is it resonated across the LIHEAP regulations, the activities that we do, and on a day in and day out, all of our state, tribal, and territory grantees, including local agencies' work is reflected with that mission and purpose in mind. I also would like to thank the entire LIHEAP network during this pandemic to really help our customers with variety of needs. What we are learning during this pandemic is that households are experiencing unpaid energy bills, unpaid medical bills, energy prices are going up that you're learning not just from the press, but also from our office. We have created a dashboard and also created grantee by grantee energy price impact one pager, which shows how energy price increases is going to impact the average benefit on LIHEAP households. For example, a $500 benefit of LIHEAP, which is a nationwide average, is not going to create a huge impact on someone's average home energy bills, especially if it goes up by 20, 30, 40% in the upcoming days. So it is very important for all of us to understand that even though LIHEAP is a single purpose program, in other words, the primary purpose of LIHEAP is to reduce home energy burden, we do have a lot of room to think about case management. We have a lot of room to think about benefit enrollment, as well as coordination and braiding of resources with other funds that are suited in a similar situation. For example, many of our state grantees receive funding from utility companies so that there is a private leveraging resources available, not nationwide, but in certain states. So we encourage you to look into that resource more carefully and use that funding more judiciously as needs are going up. We know that U.S. Treasury's Emergency Rental Assistance Program funding is available. Part of it is also available for utility assistance. And then finally, we are all aware of braiding of resources, LIHEAP resources with DOE's Weatherization Assistance Program. So all these examples I'm bringing up today to make just one key point that our needs are diversified. We are seeing some very specific type of needs among households with vulnerable individuals, such as elderly, as well as young children. We're seeing different kinds of home energy needs in the rural versus urban areas. We're seeing various kind of home energy burden differences among ethnic minorities. So when you design your benefit matrix, when you design your case management, please keep these things in mind, because equity also plays a big role in LIHEAP world. board. Finally, before I hand it over to Joji, I just wanted to mention that last year, LIHEAP saw the highest amount of funding increase with $4.5 billion in ARP investment. This year, we got $100 million in infrastructure funding for LIHEAP. So when we add these supplemental fundings to our regular appropriation, we have a much larger pool of LIHEAP funding available to the entire network than ever before. So what it means is that all of the earmarking caps have changed. So Assurance 16, we say 5%. That 5% is much higher with the ARP investment. Administrative funding, even though it's never sufficient, is much higher. So I encourage all of our grantees to look into these various earmarking caps and increase allocations to case management or Assurance 16 if that makes sense for you as a grantee, because we do have very short-term need to reduce crisis, but also we all have a very long-term need of reducing energy burden for American households. So with that, I'm going to hand it over to Joji. Thank you so much.
Thank you, Akam. As you know, HHS administers various essential wraparound services. And in this illustration that you're seeing on the screen, here are examples of those services essential to enhance the lives of LIHEAP households and to move the household to the different levels of self-sufficiency. No matter where and when are they in the point of entry into the social service system. Coordination and collaboration are key strategies that LIHEAP grantees could add to their service planning for their household. The overall goal of the wraparound services is congruent with the mission of the U.S. Department of Health and Human Services. According to a study done on behalf of HHS, policymakers are encouraged to provide comprehensive wraparound supports and opportunities to develop life skills. Participants identified two benefits of wraparound supports. First, support such as childcare or transportation assistance alleviated some of the logistical barriers to program participation. Second, participants discussed how skill-based opportunities like workshops and classes created time and space for them to think about and care for their emotional well-being, particularly as related to parenting. Next slide, please. Case management approaches can be applied to LIHEAP household with multiple needs that requires multiple wraparound services. These services can be offered based on need of the families, such as social services, employment services, Head Start and Child Care, SNAP or food assistance, housing assistance, and utility assistance like LIHEAP, LIHWAP, and broadband, and even mental health and other relevant services. Case management starts with the assessment of needs and identifying the appropriate services to meet these needs. In social work, it is called the psychosocial assessment, applying strength-based interventions and advocating for system change that affect the households. Although case management is not a requirement, HHS encourages the use of the approach to assist households with highest needs of those that we serve. I would like to remind everyone about the federal LIHEAP requirements of providing highest possible benefits to households with lowest income. Under LIHEAP, case management is an allowable activities and can be funded through the Assurance 16 funds and even administrative funds if these are available and defined by your own rules. So I'm giving you our next speakers, who are Nancy Stephens and Doris Callejas, who will be discussing the roles of social workers and case management managers in LIHEAP. But before their presentation, let's have the first poll. Take it away, Richard.
You're muted, Richard.
Thank you. You should be able to see the poll on your screen right now. And our first poll question is, what are the top 3 Assurance 16 activities based on your needs? We ask you to complete the poll right now. Numbers are coming in rather rapidly. It looks like crisis prevention activities and client support is in the lead at over 70%. That appears to be closely followed by counseling for energy burden reduction. Coming in at 3rd place, I believe, is financial counseling. It looks like most of you all have completed the poll. So thank you for your participation, and we'll go to our next speaker in a moment. Nancy?
Thank you, Richard. So now we're going to spend a little time taking a more in-depth look at case management practice, and we're going to consider it from a social work practice perspective. For many, or maybe all of you, this will be familiar information, particularly if you have a social work background, but we think that it will be a good refresher as well as a good overview, and will provide you with a framework for considering your case management work. So first, let's consider the definition of case management. The National Association of Social Workers has a definition, and you can see it in the blue box to the left. They define case management as a process to plan, seek, advocate for, and monitor services from different social services or healthcare organizations and staff on behalf of a client. To give you a little bit of history, the profession of social work and the practice of case management both emerged simultaneously in the United States during the late 19th and early 20th centuries. That was fueled by poverty and other social problems of the time, including issues like industrialization, urbanization, immigration, and population growth. As a result, charity organization societies, as well as settlement homes, opened all across the United States. Today, in modern society, some of the same social problems drive the need for and practice of case management, and you will find case management practice in many different settings, as you can see in the list on the slide, including areas like housing, disability services, income support programs, and healthcare, just to name a few. If you're going to implement case management using a social work perspective, it's also important to consider the guiding principles of social work, which say that the primary goal of social work case management is to optimize client functioning and well-being by providing and coordinating high-quality services in the most effective and efficient manner possible to individuals with multiple complex needs. There are certain standards for social work case management that must be maintained. There are 12 standards outlined by the National Association of Social Workers Code of Ethics, and they are listed here. These are all important and all apply when implementing LIHEAP. However, I'm not going to discuss or try to describe each one, but rather there are a few that I want to highlight. Starting with Standard 4, which reminds us that case managers should facilitate access to culturally and linguistically appropriate services and resources. Next, we'll consider Standard 5, which focuses on assessment. Here, it's important to engage clients and, whenever appropriate, other members of the client system in ongoing information gathering and decision-making toward helping clients identify their goals, challenges, and strengths. Strengths should also be considered in relation to our next standard, which is Standard 6, which is service planning, implementation, and monitoring, which are basically all pretty self-explanatory, but we want to emphasize again the need to adopt a strengths-based approach as you do work in each of these areas. It's also important to remember Standard 7, which is advocacy and leadership, and its guidance to advocate for the needs and the well-being of LIHEAP clients. And let's also take a look at Standard 8, and it's focused on interdisciplinary and interorganizational collaboration, which is an important approach used in administering LIHEAP when we talk about the braiding of resources. Standard 9, which is practice evaluation and improvement, which serves as a reminder to consider program evaluation of your LIHEAP program toward any needed improvements. And lastly, let's consider Standard 10, and it's focused on record keeping, where we're reminded that as you work with LIHEAP recipients, it's important to maintain a client's privacy and confidentiality whenever possible. And now I'll turn things over to my colleague, Doris Callejas, who will provide more information about case management.
Thank you, Nancy. And I will be talking about case management and the use as a method. The method for using case management approach in a day-to-day activity includes a workflow process that starts with determining the needs and the strengths of the client. In the case of LIHEAP, these are households receiving LIHEAP benefits. Developing a plan for effective services and or treatment, identifying and linking the client to appropriate services and resources, developing a treatment plan and monitoring the effectiveness and efficiency of the plan, and reassessing and reassuring the progress. Next slide, please. One area of confusion for many people is the difference between a social worker and a case manager. While these professions differ in some ways, they do have some overlapping duties. These commonalities are seen in certain duties, and it's highlighted in the oval in blue, and it includes assessment and intake, values, coordination, and support. Case managers are social services workers who coordinate care for the clients and work with agencies and institutions to ensure that clients get the care they need. A case manager might perform intake interviews to get a better understanding of a client's needs and assist clients in developing plans for addressing their long-term and short-term needs and goals, and help the client get connected to needed services such as financial assistance, counseling, or healthcare. As a client receives services, the case manager might monitor and follow up with the client and work with other service providers as needed to address the client's needs. Case management is an approach that effectively links all services to help a family that has multiple needs. In the case of LIHEAP, this approach can be used for energy burden reduction, financial counseling, and overall case management with other programs. Our next speaker is Kate Thomas, and she will be talking more about LIHEAP and the use of Assurance 16. But before we do that, we'll have another poll question.
Thank you, Doris. Now for our second poll of the day. You should be able to see the second question coming on your screen about right now. And that question is, which approaches will make Assurance 16 case management more effective? Your choices should be on your screen, and you can vote now. See, our results are coming in. And I know that we can share the results of the polls a little bit later at the end of this presentation. Results are still coming in. About half of you have responded so far. Right now, it looks like coordination with other programs such as CSBG is in the lead, closely followed by coordinating crisis prevention with a household. And that's followed by one-on-one during intake. About a minute left in our polling. Looks like one-on-one during intake is taking the lead, closely followed by coordination, crisis prevention with the household, and coordination with other programs. Looks like all of our results are in. We'll be ending the poll now. Thank you all for your participation.
has been mentioned, LIHEAP grantees can use up to 5% of LIHEAP funds to encourage and enable households to reduce their home energy needs. This can be done by administering needs assessments, counseling, education on how to reduce the need for energy assistance, among other things. These activities can be considered part of an overall case management approach, or they can be separate from case management. How you incorporate the Assurance 16 activities into your LIHEAP is a grantee level decision. One example among many is California. They have a reduction of home energy needs program, which uses local service providers to address the energy needs of low-income households by conducting a thorough energy needs assessment, providing budget counseling, energy conservation education, and coordination with utility companies. There are many other states and tribes and local agencies who use Assurance 16 to conduct case management, and a few will explain their program shortly in this presentation. Assurance 16 of the LIHEAP statute, or section 2605B16, basically says that Assurance 16 is an optional service component that LIHEAP grantees may administer. Grantees have discretion to interpret the Assurance 16 portion of the LIHEAP statute, and specifically what qualifies as services that encourage and enable households to reduce their home energy needs and thereby the need for energy assistance. The statute doesn't go into detail about what needs assessments are or counseling, what qualifies as assistance with energy vendors. So grantees should interpret these activities and develop Assurance 16 related activities accordingly. Out of the 207 LIHEAP grantees in fiscal year 2022, 64 LIHEAP grantees, or about 31% of the LIHEAP grantees, allocated funds out of their total LIHEAP grant and American Rescue Plan funding to provide Assurance 16 activities. There were 27 state grantees, 3 U.S. territories, and 34 tribal grantees who chose to take advantage of the Assurance 16 option. And based on the fiscal year 2022 LIHEAP plans, there were $55,592,677 budgeted for Assurance 16 activities based on the combined budgeted percentage amounts in section 1.2 of the fiscal year 2022 LIHEAP plans. Now, speaking of the LIHEAP plans, this next slide is going to show you section 1.2 of the LIHEAP plan, which is the first section in the LIHEAP plan where you would indicate you want to perform some Assurance 16 activities. And this is a screenshot of the plan itself, so it's a little blurry, but we wanted to show you exactly what it looks like. But if you go to the next slide, you'll see a little bit more of a clear breakdown here of one grantee's budget that includes Assurance 16 activities. As you can see here, the grantee chose to budget the full 5% allowable toward these activities. They budgeted 40% for heating assistance, 10% for cooling assistance, 19% for crisis, 10% for weatherization, 5% for carryover, 10% for admin, 5% for Assurance 16, and 1% to develop or implement leveraging activities. I just wanted to show that breakdown so you know that you have options here, and you can kind of change those annually or even throughout the year. The next slide shows you specifically section 13 of the plan, and that's where grantees are asked to describe their planned Assurance 16 activities. And here's an example of section 13 in a grantee's LIHEAP plan. And this grantee is using Assurance 16 dollars to provide energy education and case management services. And I just want to point out there's not one right answer for this section. This is because you should determine what would be most beneficial for your communities and households and describe those activities in this section of the plan. So next, I'm going to talk a little bit about the 4 areas that grantees should consider when planning to implement an Assurance 16 component. First, grantees should consider who their target groups will be. For instance, do you want to focus on a particular vulnerable population, households who are seeking crisis assistance, perhaps those with extremely high energy burdens, or perhaps households that have a multiple range of needs. And second, grantees should consider the different structures the Assurance 16 component could have. There are different ways to structure the Assurance 16 component. The primary LIHEAP grantee can prescribe the way the program will work for everyone, or in some cases, if it's a state grantee, the LIHEAP grantee might want to allow subrecipients or subcontractors to design their own programs within parameters, or there may be a combination of approaches. Some states, for instance, might provide energy education materials to the entire state, while simultaneously allowing individual agencies to develop their own local Assurance 16 programs. There's a range. This does not include all the ways that you could structure your program, but these are some of the options you might consider when you are thinking about how you will structure your program. Third, grantees should consider what the delivery methods will be for the Assurance 16 component. Will you hold workshops in person or virtually? Will you provide trainings or demonstrations, perhaps roundtables? Will you provide some form of energy counseling in person? Perhaps you'll visit people's homes and conduct home visits. Will you maybe make a video or create content for your website about how to save energy, for instance? Maybe you will build a great referral system at your agency. These are just a few examples of how to carry out the services or activities. And lastly, we'll look at the services or activities and what they could actually be on the next slide. Can you go to the next slide? Okay, so great. Here's some examples of Assurance 16 activities and services. And I just want to reiterate, this is not an exhaustive list, but simply a few examples or ideas. First, outreach to promote the availability of Assurance 16 activities. This is simply just getting the word out about the benefits of participating in the Assurance 16 activities, or just stating what the services are and that they're available. Second, energy-related needs assessment. Some LIHEAP grantees do a logic model style assessment that includes where a household is in many different areas, including the ability to pay for home energy cost. Third, energy saving information and education. This can include things as simple as flyers and documents about how to save on home heating or cooling cost, or as elaborate as a workshop on how weather stripping around drafty doors, for example, can be done. Another example is financial literacy and budget counseling. And this can include an established curriculums that we've talked about here before, such as Your Money, Your Goals, which is a toolkit provided for free by the Consumer Financial Protection Bureau, or the Family Development Model, which you'll hear a little bit more about soon from one of our LIHEAP grantees. And you can look into these options and others for this type of activity. Another activity is a lot of grantees don't know that providing referrals to households can be considered an Assurance 16 service. And advocacy work with utility vendors. Often picking up the phone and calling a utility company and trying to negotiate a payment plan or forgiveness of a past due balance, all of that work that you do on behalf of the household to help them with their energy vendor is an allowable Assurance 16 activity. And The work that you're doing to collaborate with other programs can be an Assurance 16 activity as well. For instance, when you meet to discuss a state-funded or utility-funded energy program and how LIHEAP households could benefit from those programs, and that might be an Assurance 16 activity. So all of these various activities I've discussed here can be charged to Assurance 16 to that portion of your LIHEAP budget, including others that are not listed here, such as benefits or incentives to individuals for participating in Assurance 16 activities. And now I'll turn it over to John Thompson to talk a little bit more about the fiscal aspect of Assurance 16. John, you may be on mute.
Okay, I'm so sorry. Is that better?
Yes, we can hear you now.
All right. No matter how many times we say, turn off your mute during a Zoom call, there's always that person who does it. So today I'm that person. so anyway, I'm glad to be able to get to this part in the presentation. Kate, thanks for everything you said. It's a good segue to lead to some of the things that I'm going to talk about. And as Joji mentioned earlier, Assurance 16 is not a required component of LIHEAP, but we encourage you to run it because of the great benefits it can provide to the community. So now what I'm going to do is I will speak of 4 examples of how Assurance 16 can be administered. Hopefully, if you're running the Assurance 16 component, these examples can provide a little insight and help you enhance your program. But if you're not running one yet, hopefully these examples can help you feel inspired to want to start the component. Next slide. Okay, so in this slide, it applies to subgrantees and local agencies, and this is the grants example. And so here, subgrantees, as you see, are local AAs or local administrative agencies are encouraged to conduct activities to meet their community's needs. And why is that important? Because each of your communities around the nation have different needs. So finding out exactly what that is for your community to maximize these funds is great. So we encourage you to first conduct that part, or assessment before you want to start this Assurance 16. And so local agencies who want Assurance 16 funds must apply for them through the state. And here are some outliers here of, some minimum requirements that would be needed to apply with the state in this example of the grants example. And pay attention, see here, what are the impacts they hope to see, how the impacts will be tracked and measured. Those are some good benchmarks to answer before starting in this example here. Next slide. So in this example here, the automatic allocations example, local agencies get a certain amount from the state, and secondly, there has to be a list of acceptable Assurance 16 activities that are already approved. And so some of those examples could be like referral to other sources of a utility assistance, or assisting in setting up utility payments with a vendor, or even budget counseling related to an energy cost budget, or providing energy education in a household, or even giving energy intervention on behalf of clients who have received LIHEAP, or providing a weatherization needs assessment and a referral. So those are some examples from, those are some examples of some acceptable Assurance 16 activities. And so once that has been established, then agencies must approve a plan and how they'll use the funds. And here are some benchmarks here that would be that can be used. And also in this example, agencies who opt out of Assurance 16 or choose not to run it can easily shift their funds or reprogram them for heating and cooling. Right. So here in this example, the statewide initiative, this example is almost identical to the previous example, being that local agencies can have to choose from a list of acceptable Assurance 16 activities. But lastly, you see here that agencies must submit a plan and how they would specify use of Assurance 16 funds. So the statewide initiative is almost the same as the previous example, with that exception. Next slide. In the hybrid approach, this example is different in the sense that local agencies can opt to apply for additional Assurance 16 funds. And so here, with that hybrid approach, that given that this caveat right here can opt to apply for additional funds for special activities, these are some benchmarks here, as been mentioned before, that for some special activities that can be approved within with your state. So here for the budgeting component, I want to mention that in the examples that were shown previously, they're all run by local administrative agencies. So tribes and territories obviously don't have local agencies, so it would be more of a central decision-making process at the tribal level. But also here, some important things for budgeting obviously is the tracking aspect and the budgetary impact that the Assurance 16 component will have on your LIHEAP program. And as I think previously mentioned, you can use up to 5% of your 5% of your LIHEAP allocation towards Assurance 16. You can always use less, but you can't exceed 5%. Right. So here, what monitoring procedures will be needed to adequately assess and report on the effectiveness of the Assurance 16 component? Well, as you see here, the important thing is just to establish the goals and targeting activities. And once you have those three items identified, then it makes rolling out the Assurance 16 component that much easier. And so having a goal here, which here is just to reduce the number of households in crisis. Target is, the persistent crisis households, and the activities and how that would be accomplished. And so, as you see here from this example, these two arrows reporting the number of households and what would be the end result. So here, attending a presentation, installing measures, and moving down here. Once you have implemented this part, then you document in your individual case files. And what would that take? That would take obviously staff time. So you want to make sure staff is allocated their time properly, and the participation with the households and what kind of results come with each household. So this is a great example of the Assurance 16 component. And lastly, here, you want to look at what procedures will be needed to track expenditures for the Assurance 16 component at every level. Just tracking, that's just extremely important to know, exactly what has been set aside, and not only what's been set aside, but also the impact that it has. So with this, like for staff and other allocations, it's ensuring that your staff correctly accounts for their time spent. For example, they could spend 1 hour doing Assurance 16 activities and 7 hours doing LIHEAP related work. So make sure that that's been recorded properly. The appropriateness of the charges. What do you mean by that? Well, ensuring that that acceptable Assurance 16 activities are what is being accounted for, and not other activities that are being rolled into the Assurance 16 component that you're running. In budgetary limits, why is this important to track Assurance 16 costs separately with your LIHEAP allocation? It's just ensuring that whatever percentage has been allocated will not be exceeded. In your savings and costs, at some point you want to evaluate the impact that Assurance 16 is having and whether changes need to be made to improve its efficiency. So through all the examples that we have talked about throughout this presentation, maybe some of you are already performing a lot of them already, and that's great. So if you're performing them, then we ask that you can evaluate, the effectiveness of it, the impact that Assurance 16 is having, and whether you can improve on its efficiency. So thank you for your time. And next, before I turn it over to my colleague Vicki Pretlow, we're gonna have our third poll. Richard.
Thank you, John, for that informative session. Now we're going to talk about our third poll. And that is question number 3, and that is, I'll launch it in just a second, so you should be able to see it on your screen. And the question is, how have you increased LIHEAP Assurance 16 allocations? Tell us a little bit about that. Have you increased your LIHEAP Assurance 16 allocations? I apologize if you can't see the results as they come in, but right now it appears that 81% of you have not increased your LIHEAP Assurance 16 allocations, but 21% of you have. We still have about an 80-20 split as this poll comes to a close, and we will share results of the poll a little bit later. Thank you again for your participation. Our next presenter will be Vicki Pretlow.
Vicki, you may be muted.
Thank you, Richard and John. I was doing a little behind the scenes work here, but hi everyone. So at this time, I have the honor of introducing some of our colleagues, and they're going to talk with you about some of the work that they do with Assurance 16. We're going to hear from Christine Baginski, Rebecca Hanlon, Lisa Cassell, Pam Brookshire, and Lori Walking Eagle. Next slide. So first we'll hear from Christine Baginski, as I mentioned. Christine is from the Community Action Partnership of Orange County, also known as CAP-OC in Orange County, California. Christine has been an energy professional for more than 25 years. Most recently, she has become an energy equity champion, advocating for low-income communities. She joined Community Action Partnership of Orange County in 2018 and is the Director of Energy and Environmental Services Department. And with that, we'll welcome Christine.
Thank you, Vicki. Can you see me and hear me okay?
Yes, welcome.
All right, thank you. Next slide, please. So first, I'd like to say hello from Orange County, California, where it's currently sunny and 75 degrees out. To provide some context of our community here in Orange County and how we use our Assurance 16 funds, I would like to share some facts about California and Orange County. For California, less than 5% of the total eligible population receives LIHEAP benefits. The total eligible households in California is 3.4 million. The number of households that were served under our LIHEAP 2020 contract in California was 163,000. Orange County lies south of Los Angeles and north of San Diego. We have 42 miles of coastline and have Disneyland, the happiest place on earth. However, we have a large low-income community. Orange County has a population of 3.2 million. 1 million of this are foreign-born, which means we have a highly diverse population. The residents in our community living below the poverty line exceeds 350,000. The number of seniors over 65 exceeds 500,000. A fair market rent in the Santa Ana, Anaheim, Irvine Metro is $1,900 a month. For LIHEAP 2021 in Orange County, the total households we served were 6,518. Remember, we have 350,000 below the poverty line. The average yearly household income was $18,600. This is $1,550 per month. Remember, I just shared the one bedroom fair market rent is $1,900. The average household size was 3. The average household energy cost was $108 per month, which is about a 7% energy burden. And our average benefit was $567. Of the households we served last year, the 6,518, in those households, we had 7,207 seniors, 910 children under 5, and 207 persons with disabilities. Next slide, please. Thank you. With this context of our community, in California, our Assurance 16 funds are used to encourage and enable households to reduce their home energy needs, provide participant education, budget counseling, and coordination with utility companies and other services. Our participant education during the UA application process includes discussing with our participants the need for applying for utility assistance before falling behind on payments. We provide written information about conserving energy. We provide budget counseling. During education with participants during our weatherization applications, in addition to these above, we provide an EPA pamphlet that trains Renovate Right, important lead hazard information for families. And here in Orange County, we have a very large housing stock with lead paint. We provide an EPA pamphlet, a brief guide to mold, moisture in your home. We provide an EPA pamphlet, a citizen's guide to radon, the guide to protecting yourself and your family from radon. And then we also provide description of benefits on measures that are installed and the importance of diagnostic testing. Next slide, please. This is a little bit of a reality check for where we've been. Prior to the pandemic, we would meet with our participants in a group processing setting with technicians meeting with families one-on-one and being able to provide this education. Since March of 2020, our offices, our energy offices closed. We went remote. And so you could, the way we reached our participants now was through the mail, through email, through online applications, through drop-off applications. And what we noticed is with the large senior population that we have, there was a definite disconnect with digital divide. There's complexity for seniors to actually go online and get applications. And as a result of this mode of working, many of our applications came incomplete. I want to mention that for our client education during our group processing setting, we would have the participants sign a document that said they did receive this education. During our remote working situation, we have our agency representative sign that they certified and sent this education material. Again, we have a focus on seniors. So we try to set our seniors up with as many resources as possible. Often budget counseling, they are some of the best managed folks who know how to manage their bills because they live on what seems to be an impossible income in our county. We do our best to connect our seniors with the senior food box program in our OC food bank. We connect them with CalFresh, which is SNAP, known as SNAP elsewhere. We connect them with any rental assistance programs we can. We connect them with CARE and FARA, which are utility tariff programs. Also, we let them know of any arrearage management programs or payment plans with their utilities. We connect them with VITA tax programs and then also with 211. Here at CAP-OC, we strive to provide services that encourage and enable households to reduce their home energy needs and thereby the need for energy assistance. The outcomes we monitor are reduced energy bills and connections to other much needed resources. I'd like to just end on one point, which is the need is great and the need appears to be getting greater. So thank you for an opportunity to share how we use Assurance 16, and I'll pass it back to you.
All right. Thank you very much, Christine. Next, we'll have Rebecca Hanlon from Ozark Opportunities Incorporated, which is a community action agency located in North Central Arkansas. She's worked with Ozark Opportunities for 21 years, starting out as a case manager where she worked one-on-one with families in 6 counties. She's a dually nationally certified results-oriented management and accountability trainer and implementer. And with that, we'll welcome Ms. Rebecca Hanlon.
Thank you, Vicki. Yes, we are Ozark Opportunities Incorporated. We're a community action agency in North Central Arkansas. We were established in the 1960s to combat poverty. And our 6 counties, we are in the Ozark Mountains. So we're very rural, rugged terrain. And like many, transportation is a challenge. So it's not unusual for those that needed assistance to have to travel in excess of 100 miles round trip for assistance. So pre-pandemic, we were predominantly an in-person organization, meaning that people normally applied for assistance in person at one of our locations. We did and still do have drop boxes, mail, email. However, most people use those secondarily. When the pandemic hit, we went virtual almost overnight. And this was an amazing feat. And I credit that to the strong relationships that we have with our funders and our team members. We worked well together and continue to do so while keeping people, the public, our clients, and our staff safe while still continuing to help people. And although we are now open to the public again, applying for assistance virtually is still very popular. And I don't see that changing. It's very helpful for those that are working, the working poor, to apply virtually, and those without transportation. You can imagine, especially right now, it saves a ton in gas where they don't have to travel 100 miles to apply for any of our assistance. Since 2020, the Low Income Home Energy Assistance Program is administered through Arkansas Department of Energy and Environment, Division of Environmental Quality, Energy Office. Before that, it was through the Department of Human Services, Office of Community Assistance. Our Assurance 16 program contains 4 primary phases and usually builds off each other. And we call our Assurance 16 program Success. And this graphic displays the 4 phases, the normal progression between each phase, and some examples within each category. So you can think of this graphic as a scale where the majority of the people that our family development team works with are in crisis, in the crisis stage, and that number decreases with each progression. So they may start out working with 200 families that are in crisis. However, only a dozen may actually complete to the giving back phase. And the longer that a family is dedicated to our program, the more resources we may need outside of Assurance 16. Often, most of our Assurance 16 families are in the stability and learning phase. And when funds are depleted or the program has ended, we just don't simply stop working with those families. We end up coordinating with other resources like Community Service Block Grant, United Way, and when possible, private donations to continue working with these families so that they can get back on their feet. One of the first things conducted upon enrollment is a needs assessment. And as you can imagine, most families are in some type of crisis, and it's not usually restricted to only a utility crisis. For instance, if it's a gas or electric disconnect, often they are also fearing losing their housing, or they're fleeing domestic violence, or they've got health emergencies. There's usually another emergency they're contending with. At this point, our family development workers are focused on alleviating that emergency with that family. Those families are not ready to think of the future. They're only focused on surviving the day, the night, maybe the weekend. So they're not in the mindset of thinking of goals. So once that crisis or those crisis emergencies have been alleviated, then the team, the family development worker plus the family, transition into the stability phase. So now that team, again, the family development workers and the family, work together on developing goals and creating plans for the future. This is the true sense of our family development program, or case management in Assurance 16. This is when it really becomes impactful. The goals are created, the short-term goals are created to stabilize the family and decrease the chances of repeating that original crisis that brought them to us to begin with. And then we concentrate a lot on the development and learning phase. This is the basic life skills training, budgeting, job readiness, nutrition basics, and then more comprehensive training like financial literacy and career advancement for those that are already working, and leadership development. And then the final stage is giving back. And those that graduate here are often mentors for those that are newly enrolled in our program. They become members of our council, board of directors. They participate in our focus groups. They co-facilitate some of our meetings or group sessions, and they become our biggest advocates. We often see the low-income home energy assistance program as a gateway into our impact-related programs like family development, where we help thousands of individuals with utility assistance. We may only help hundreds with family development. However, those impacts are far-reaching activities. And then I did show just a basic budget for our participants. We do concentrate heavily on training and education. And then we've got a small budget for self-sufficiency support and then recognition. We do believe it's very important to celebrate all those successes to keep motivation rolling. And we wanted to highlight the importance, not to overlook the human aspect, the importance of that one-on-one contact our family development workers provide. For instance, this pandemic increased the number of individuals experiencing poverty for the first time. Those that were seen as doing everything right throughout their entire lives. This story is not isolated. I know others have dozens of stories that they can share, but I felt this was a perfect example of someone who thought they had done everything right. This individual, she's in her mid to late 50s. The last 10 years, she's dedicated to the medical field, averaging 50+ hours a week. No subsidies, no problems making ends meet, purchasing her own house. She did end up contracting COVID-19, had a hard time recovering. She did receive 1 month of unemployment, was denied additional unemployment benefits. She was diagnosed with a heart condition and lupus brought on by COVID, which prevented her returning to work. She applied for disability and was denied. Her house was in foreclosure. She was 2 years away from having it paid off. She was selling everything that wasn't nailed down to pay her house payments. This is when she met us. She went from completely vibrant, independent person to complete depression. During her 1 year, her end of the year evaluation, this is what she said about us. And I thought this just really drove down the impact of our family development programs. And I will try to quote her without choking up. So I've had to practice this a few times. So I quote, "I went from having a gun to my head to finding hope again. The people who ran this program overlooked all the negative things about me and are good people who truly care. And I needed that most. They didn't get mad when my mind wouldn't work. They let me know that there were people who care, and this was one of the best things that's happened to me. I am learning to be grateful for the good days that I have. I appreciate you, and because you guys were all I had during my dark time. I am making new friends and good things are happening." I couldn't find a more powerful statement. I just cannot tell you how many times I had to practice that without getting all choked up. So thank you for bearing with me. I thought it would have been just a travesty if this person was no longer with us, if she had carried out her exit plan. Again, things are going much better for her. I'm happy to say that her house is now paid off and she does receive disability. We did become great advocates for her, and justly so. Again, thank you for this opportunity to share.
Thank you, Rebecca, for that really touching testament from your client. That was really kind of hits home for the work that we do. Next up are Lisa Cassell and Pam Brookshire from Bright Point in Indiana. Lisa is a family support services manager at Bright Point and has managed the various utility programs, including LIHEAP and the Child Care Development Fund since 2012. Pam is the Vice President of Community Services and has served in that position for 15 years. Welcome, Lisa and Pam.
Thank you. I'm Lisa Castle, and our first thing I'd like to share with you is in 2020, we helped over 17,000 unduplicated families and over 30,000 individuals. These numbers do not include the people who receive more than one service. We do receive funding from a combination of federal, state, and private sources, and our total revenue for 2020 was $23,635,830. The total funding that we expended was over $33,802,000. We do keep our administrative costs at 5.9%. Next slide. Our official service area is the northeast corner of Indiana. We do service approximately 14 counties. Each program does have its own service area though, so some of our programs are offered only in specific counties. However, our largest county, which is Allen County, we do have every program in that community. Next slide, please. Bright Point's Assurance 16 activities utilize a two-prong approach. Our first approach happens in our Family Support Services Department, where we briefly assess all energy assistance applicants on their current conditions. Our second prong is in the Family Development Department, where we provide case management services to EAP applicants and other households who score low overall on the Family Development Matrix and/or who score low in the utilities life area of the Family Development Matrix. Next slide, please. As we previously heard, Bright Point does recognize that providing referrals is part of our approach. Every utility assistance applicant does receive the Bright Point referral form at time of application, And we do ask that they submit it back, even if they aren't requesting referrals at this time. Once they have provided that to us, we then give them the additional information to the program, or we make the referral ourselves if it's within our agency. Next slide, please. So I spoke about the family development matrix, and our family development matrix has 12 life areas that we look at. The 3 dominant life areas are income, adult education, and employment. The basic needs is housing, food, childcare, healthcare, transportation, utilities. And then there are 3 supporting factors: support systems, family interaction, and addictions. In the family support department, we are specifically looking at the utilities life area. As you can see here, we rate them as being thriving, self-sufficient, stable, vulnerable, or in crisis. And as you can imagine, most of our clients are at the vulnerable or crisis state, where they are either due for disconnect and their utilities are in someone else's name, or their utilities are disconnected already. At this point, we would move, if they're at vulnerable or crisis, we then do a referral to family development in order to hopefully involve them in some more voluntary case management services. Pam?
Thank you, Lisa. Once the Family Development Department receives those referrals from the Family Support Services Department, then we initiate contact to enroll households into Family Development Services if they're interested. If they agree, then we conduct a more in-depth family development matrix to determine any strengths and opportunities so that we can start developing goals and developing their action plan. Next slide, please. The family development program is actually a system, and the matrix is just one tool within that system that we use to work with each individual family. There's also the family development action plan, the score sheet, interview guide, and the manual. The score sheet is just a way to track improvement in family conditions over a period of time. So in our family development program, we do the matrix and the action plan about every 3 months. Sooner if conditions change, either positively or negatively, but definitely every 3 months. So the score sheet is a way for us to track those different scores over a period of time as long as they're in the program. The interview guide is just something that we put together in order to assist with scoring the matrix. It's just some question prompts to help our family development workers or case managers to score the matrix, questions to ask the family to prompt some specific answers. And the manual is just a how-to guide if you're interested in formulating and creating your own family development program. The 5 documents work together as a system so that we can accurately assess the family condition, monitor their progress, measure their outcomes, and hopefully garner great improvement in increased economic self-sufficiency. Next slide, please. So after the matrix is completed, we do a family development action plan. And as you can see, the action plan is divided up into 3 areas. The first area is the long-term goal, and that's the threshold where they want to be on the action plan. So we do an action plan for every area on the matrix that they want to work on, every life area. We do try to limit it to 2 or 3 at a time, but whatever condition they want to be on, that is their long-term goal. So if they want to be stable in the housing life area, that is their long-term goal. Then we start developing intermediate goals, which those goals are changes in behaviors and practices that will help them meet that long-term goal. And then the intermediate goals are built upon by their initial goals. Those changes in skills, knowledge, and behaviors, attitudes, that will help them change their behaviors and practices in order to meet their long-term goals. Each goal has a target date, a completion date, and as I said, they are completed at the same time that a new matrix is done. May I have next slide, please? Family development, all case management programs are very difficult to fund. They're very expensive programs. They're very staff intensive. Funders are not keen on funding them because of the expense. So Assurance 16 is just one of the many funding sources we use to blend together in order to create a family development program. To ensure that we're doing things properly, we make sure that every family that's in family development has a utilities action plan. Even if that desired income is just to achieve or remain in stability, then that's what we do. Again, that action plan is where the family wants to be. If stable is all they want, then stable is what we will strive to keep them at. Our family development program, as I'm sure many across the country have experienced as well, we've been extremely focused on housing stability the last couple of years. So, and maintaining utilities is, of course, a major component of keeping people stably housed. So it's entirely appropriate for a utilities action plan to be part of every household's journey into economic self-sufficiency. And as we put together these slides, I started thinking that even though adult ed, income, and employment are our dominant life areas and are the three that most effectively impact economic self-sufficiency, that utilities in the housing life areas have really become quasi-dominant life areas. They are basic needs, of course, but if you don't have a roof over your head and if that roof doesn't have electricity and heat, then working on action plans and employment, income, or adult ed just really aren't that likely to occur. So I think that there's something to be said for them being an all-inclusive package. And I also listed some additional funding sources that we use. SSVF, if some of you are familiar with that, ESG, United Way, and private foundations. Next slide, please. So if you'd like any more additional information, oh, I'm sorry, I forgot, I have a story. So just to give you an idea of one of the people that we serve, we have a young woman with 2 daughters, whom is autistic. This young lady was involved in a very violent marriage. After 8 years, she finally realized that she needed to get out. So she was able to escape and go to her parents' home, where she was able to save some money, get employment. For the first time in her life, she had actually achieved some control over her life. She reached out to us because she wanted help locating housing. So because she had never had credit in her name or had housing in her name, the housing she located, the landlord wanted a triple deposit in order for her to rent. We fortunately have a landlord incentive program, so we were able to assist with that deposit. And now she has her own home, 3-bedroom home, utilities in her name, her own phone in her name. She still has a job. She's applied for SNAP. She's enrolled her younger daughter into our Head Start program. And we're about to ask her to move into a higher caliber, higher level of family development, because she has done so exceptionally well. So we're very proud of her. As you can see, these are some numbers of those 17,000 individual or households that Lisa showed you. About a little more than half of that are energy assistance households that we serve. But as you can see, the number that we serve in family development is just a small, teeny tiny fraction of the people that we serve overall and in energy assistance. Part of that is people who are interested in the program, who would like to follow through. A lot of that has to do with funding. If I had my choice, I'd have 200 case managers and a lot more funding in family development than I do in EAP, but I don't always get what I want. So thank you very much for listening to Lisa and I. We're very grateful that you had us here today. Here's our contact information, and we're always happy to talk about what we do and how we do it if anyone would like our help. So thank you.
All right. Thank you, Lisa and Pam, and again for a beautiful example showing how the work you do affects folks' lives in your community. And last but certainly not least, We'll hear from Lori Walking Eagle from Rosebud Sioux Tribe in South Dakota. Lori is the director of the Rosebud Sioux Tribe LIHEAP and LIHEAP programs. She received her master's degree from the University of Denver's advanced program and her bachelor's in social work with a minor in psychology from the University of Nebraska. She has a daughter, Aria, who is a nurse, and a son, Michael, who is a lieutenant within the adult correction system. She also has been blessed with 5 beautiful grandchildren, which is wonderful to hear. So with that, we'll welcome Lori Walking Eagle.
Good afternoon, everybody. It's really windy here in South Dakota, and my internet, it keeps saying that I'm getting knocked off. So please bear with me. I hope I don't lose you guys while I'm speaking. I am from the Rosebud Sioux Tribe, which is located in the south central part of South Dakota. We work with 4 counties, and we are one of 9 reservations in the state of South Dakota. We're the 2nd largest. The Ogallala Sioux Tribe is the 1st. We have approximately 35,000 enrolled members, and we help 40% of the households. We have approximately 2,850 household units that comprise of HUD housing, transitionals, which were the first houses built from, they're called transitionals because they were moving from the teepees and tents into more structured housing. We still have a lot of transitional housing. We have the Sioux 400s, and the majority of them are trailers that we have as well. So we assist 40% of the household members, approximately 1,150. Within those housing units, we have 10 to 12 people averaging that live in the houses. Under the Assurance 5, you have 5% of it you can use as an option to provide services that encourage and enable households to reduce their home energy needs. The difference, hello?
We can hear you, Laura.
Okay, you can reduce their home energy needs and thereby the need for energy assistance, including needs assessment, counseling, and assistance with energy vendors. Next slide, please. Next slide. On the second slide, that's not up yet, I have the Assurance 16, the difference between Assurance 16 and weatherization. Under Assurance 16, you can use 5% of your funding. Under weatherization, you can use 15% or up to 25% with a waiver of approval for the funding to provide weatherization. The 2 differences is that you encourage and enable households to reduce energy needs by assessing, counseling, or assistance with energy vendors. And under weatherization, you can provide low cost weatherization or energy related home repair. Next slide, please.
Lori, we can see your slides, but I don't think you can. We're on slide 3.
Okay. So under Assurance 15, we manage different homes. We actually, with a social work background, we take a holistic approach. We work from the macro level to the micro level to the macro level. And we monitor, we do home visits, we assess, we educate, and then we develop a utility action plan or contract with the families. We collaborate with other programs and we refer. Under monitoring, at intake of the application and electricity bills or heating costs, we monitor the families' bills that come in, and we identify the families that have the higher heating costs. We then go and schedule a home visit with the families. And because of the intergenerational mistrust, we still have that residue even in 2022 with our families, where we tend to get them at that crisis level. They are unwilling to follow through with providing paperwork because they're not sure if we're going to report that they have more families in the household than they should under HUD guidelines, or if they're receiving some type of services where we have like intergenerational poverty, where, you know, grandma's on a fixed income of SSI, and, you know, you have some people that are in TANF, and they also have, you know, the boyfriend living with them or the father. So within that intergenerational mistrust, we have to have that in mind as we go into the home seeking the spokesperson for the family. Usually that is the elder grandmother or the oldest daughter. You usually would expect it to be the son, but it isn't. It's usually the daughter or one of the older females. When we go into the home, we're cognizant of the families, how they connect with you. So they'll ask you which community you come from, which family you come from, who your grandparents are. And so we have to develop that type of rapport with the families as we go in to explain that these, you know, we need some type of documentation for to complete their applications. As we go into the home and we tell them why we're in the home, we assess by the number of households that are in the home, their electrical use, and the condition of the environment. And usually when we go into the home, the first thing that we note is, you know, they still have their lights on the outside, or they still, sometimes they'll have their Christmas lights hanging up outside that are still on during the day. There'll be people in their rooms that aren't listening to the radio, but you can hear a radio in another room or a TV going in. So these are the types of assessments that we make with the family when we go in. We then discuss ways to save energy with them. We bring out, well, you know, is everybody in the room? The radio is on, you have the TV on, you have this light on, and we go through with the family, seeking ways on how we can make something cognizant or tangible for them to see how and why their energy bill is so high. Sometimes they range from 7 to 9. We have some bills now that are 1,500. And we go out to assess and discuss with them. After we educate them on some of the simple or the minor ways to start conserving energy, we develop a contract or a utility action plan. What we do is we have the previous 6 months bills listed at the top of the plan, and then we start talking about ways they can conserve energy. We talk about what they are eligible for on their monthly certification. Coming from a strength-based perspective, I then ask the family to develop some goals or to develop some ways on how they can save the energy. I remind them that it's their bill, it's their home, that I could come up with some plans, but it isn't going to work. It needs to come from the family. And then we leave, not only do we leave pamphlets, but coloring sheets for children to remind them what they can do to turn off the light as when they leave the room, not to have all these radios on. And they do develop, they ask you to write it, but they will tell you what they can do. And then they will sign it. When we come back, we refer and work with other programs, collaborating, because sometimes we have elder abuse, because we have a lot of the adult children that will take the elders. Some of their monthly subsidies come on cards. So they will take the card and they will deplete their account. So with one of the elders that we worked with, when I went out into the home, she had numerous broken windows. She had a water behind her washer. The hot water pipe was leaking, and it was leaking into her basement. She had a lot of the lights on that were in the home, and the grandchildren were not in the rooms. So and then she had cold heating. Now, cold heating was supposed to help her reduce the need for energy, but The cove heating, to my understanding, was that it took off from the energy of the appliances that were in the room or the furniture. Well, she didn't have a whole lot of furniture. It was very bare, just one table by the window and a bench. And then she had a lamp, and then she had her wood stove. So the cove heating wasn't effective for her. So we got her a wood stove. But when I got back, we referred her to our SWA program, which is the Sichangu Wichoti Awayakapi, which would help her get the heating stove and look at the cove heating. We then referred her to Elderly Affairs, where they were able to send out several people to fix her pipes. And then with our weatherization, previously there was numerous windows that were left. And so we hired individuals to go out and fix all of her windows in her home. And then we talked with the grandchildren and had told them that what they were doing was elderly affair with elderly abuse, which is in our tribal code. And that the next time that the windows got broken out or there were pipes that were broken because they were hanging on them, that, you know, they could get referred to the court system. Her energy bill went way down. She stayed underneath her certified amount. She was very grateful. And the older sisters were able to talk with the younger sisters to keep them from taking the card. They actually got her a new card. So that's how we refer, and then we collaborate with others in our reservation. We coordinate services with ERAP, which is the Emergency Rental Assistance. So if a person is applying there at ERAP, which is under the SWA program, if they're applying for electricity, they will call us and ask if they're getting help with the electricity or propane. And if it's either or, they will help with the one that they're not receiving services for. The LIHEAP program, that's just a new program that just got concepted within this past year. We're looking at assisting some of the tribal members that live in counties where they have to pay the water to assist them with the water, sewer, as well as some of the arrearages. When we're under these assurances, when we're looking at the issue to address, it's the energy conservation. We use the funding to assist with materials and costs when meeting with the family. The impact that we hope to see is that we reduce the costs of a lot of the energy bills within the homes. And how we track that is by them, by the family signing the utility action plan and then seeing the lower costs in the utility bills. It is effective for us to go out in the home and work with the families because we have seen a lot of energy reduction within the utility companies. Next slide, please. Thank you.
Okay, thank you so much, Lori, for that example. I think those are really good examples of your partnerships to help the people in your community. And a really big thanks to all of our guest presenters. You've shared some valuable information. I'm sure you've really inspired all of the listeners today. Right now, we'll have Rich come back and he's going to conduct another poll for us. And then we'll hear from Ms. Melissa Torgerson.
Thank you, Vicki. And that was absolutely fantastic. I love the anecdotal stories to share the success of the work that you all do on the front lines every day. So thank you to each and every one of our presenters for your invaluable input. Our poll question number 4 is, are there any barriers that prevent you from allocating the full 5% of your federal resources towards A16 activities?
Can you show
Once
the
again,
poll? Are you all seeing the poll?
and you should be seeing the poll now. And once again, the question is, are there any barriers that prevent you from allocating the full 5% of your federal resources towards A16 activities? This is a long answer, so.
Sorry, Richard, we can't see it.
I think some of us can, and some of us can't. I can see the poll.
Oh,
I can see the
good.
poll too. I can see the
Great.
poll as well.
That's all right. Thank you.
If you can put in your answers there, we'll appreciate it, and come up with a summary later on of some of the responses that are barriers that prevent you from allocating the full 5% of your allocated dollars. But now we're going to move on to our final presentation, and that's going to involve tracking and evaluating Assurance 16 impact. And our presenter will be Melissa Torgensen. Melissa?
Thanks, Richard. Hi, everyone. I'm Melissa Torgerson, and I'm going to talk very, very briefly today about measuring the impacts of Assurance 16 programs and services. Now, reporting, evaluation, continuous improvement, performance management, they're all important aspects of any program. But for Assurance 16, they're especially important because, as you've heard throughout the presentation, the LIHEAP statute outlines a minimum set of data collection and reporting requirements for grantees who wish to use Assurance 16 funds. So in your model plan each year, you're going to be asked to provide a description of your Assurance 16 services, the number of applicants for Assurance 16, the number of households you served with Assurance 16, a description of the direct benefit provided to those households, as well as a description of the impact of those services. And so in order to collect and report all of this data, state and territory and tribal grantees, as well as local agencies, are going to need to spend at least a little bit of time planning and thinking about evaluating their Assurance 16 program. So let's just talk a little bit about this. Next slide, please. So we all think of evaluation as some big, fancy, schmancy, sophisticated, complex process, but in reality, what all we're doing is we're making sure that our program is doing what we intended it to do, to reach the goal we intended to reach. And then using whatever learning we get out of that to tweak our strategies, or maybe even revisit the original goal we started with. But in order to do this, you have to have a goal to begin with, right? And the statute gives us one big, hairy, audacious goal for Assurance 16, and that is namely that households will reduce their home energy needs and thereby the need for energy assistance. But as you've heard on this call, the strategies used to reach that overarching goal are really different based on your community needs or the skills and expertise that you might have in your agency. Furthermore, any social worker or case manager knows that when you're working towards a long-term goal, reaching it means that you have met several intermediate and multiple intermediate goals and successes along the way. So in other words, while we're all reaching towards the same big goal for Assurance 16 of reducing the need for energy assistance, all of the strategies that you employ and the interim outcomes that you decide to measure are going to be uniquely your own. And this is why it's so important to spell out a plan for implementing and evaluating your Assurance 16 programs. And evaluation, there are myriad ways to do it. But we're going to walk through just one example today to get you thinking about how to approach this within your state or your territory or tribe or local agency. So next slide. So you've seen today a wide range of examples. Some folks do very comprehensive case management with their Assurance 16, while others have more targeted, limited services. And regardless of what you're doing, a logic model or a similar tool can help you outline clear and intentional goals and measures. The tool itself is not as important as asking yourself some really key questions. So let's walk through these. First, what is the problem we want to solve? So once again, remembering this big, hairy, audacious goal, if we really want to reduce the need for energy assistance in the future, what specific issues are we seeing among the households we serve that are keeping them coming back year after year? And many of us can sit and think about several reasons they're coming back year after year. So is there one specific problem that we want to tackle first? Given the problem we identified, what specific services will we provide to resolve it? So what do we think will be most effective in resolving the problem we're seeing among our households? How will we measure outputs? Now remember, outputs are about agency transactions. So this is about how we're using the money, how we're delivering services, and who we're delivering services to. So how will we measure that? And then the remainder of the questions focus on outcomes. So outputs, you've probably heard this before, outputs focus on agency transactions, how many people we serve, how many widgets we churn out, essentially. But outcomes are all about household transformation. So how are we changing the knowledge, attitudes, behaviors, or conditions of the people that we're helping? And so in the example that we're going to walk through, we look at short-term outcomes. So these are things that are pretty quickly observable. Long-term outcomes, so things that change over a period of time, and then the impact of Assurance 16 programs. And when we do an impact evaluation, we're not just looking at the people who get Assurance 16, we're looking at those eligible households that didn't participate, because then we can really see the true impacts of the program on the households that we're serving. So let's just walk through a real life example really quick. This is going to look a little bit like what Lori just talked about. And what you heard from her, she clearly, in fact, answered some of these questions. And so it might sound a little bit the same, and that's a good thing. So remember to start with our overarching Assurance 16 goal. It's the same for all of us, which is to reduce energy costs and thereby reduce the need for energy assistance. And we start with that in mind. And in this example, the agency said, what problem or specific set of problems are causing people to seek energy assistance year after year? And in this case, they were looking specifically at people who come in year after year seeking crisis assistance. And so they determined a few different things. A number of the households they see have high energy bills, electric in particular. They're not paying their bills during the moratorium period. They're accruing arrearages, and then they need really large crisis benefits when the electric shutoff protections end. And so this is the problem they see as to why people are coming back year over year for crisis assistance. And so to address at least one piece of this, they decided to conduct on-site energy education visits, similar to what Lori talked about, to households with exceptionally high energy costs. And so they would go out, they would look at things very specific to that household. My favorite example, Lori mentioned Christmas lights. I always hear about the beer or the ice fridge that's running in the garage that just has like a block of ice in it. So very specific to the household to help them see ways that they can cut down their energy costs. They also decided that they would refer folks to utilities to look at appliance replacements or other weatherization, low cost or full weatherization measures in order to reduce their home energy needs. When they thought about specific ways they could measure outputs and outcomes, here are some of the things that they thought of. To measure how services delivered. So once again, this is about agency transactions, how many people were served, weren't served, what did they receive? They decided to measure how many home education visits were scheduled, how many visits were completed, and then how many clients signed those behavioral change commitments. They also measured how many clients were connected with their utilities to apply for appliance replacement or weatherization programs. So notice here, they're not talking about what the client did yet. We're talking about how the agency used the money to do what they said they were going to do. And then we move into the outcomes. How did we transform the household in some way? What changes did we see in the household? And so to measure short-term outcomes, you'll notice that they used surveys to talk to the clients that were served to see how many of them were actually maintaining their behavioral commitments, as well as how many households received major appliances or weatherization services from utilities. Now, these are short-term. So if you conducted or did a behavioral contract, this is something you could look at the 3 or 6 month mark to find out what kind of progress the household was making. For longer term outcomes, they did a lot like what Lori said, and they looked at their actual bills. Are the bills going down? Are they seeing a change, maybe not even in bill, but in the consumption of energy among the households they serve? And for many states, at least, this is something they're already collecting for their performance measures. So this data may be more readily available than you think. And finally, to evaluate impacts in the long term, the agency compared the rate of crisis energy assistance applications the following year among Assurance 16 households and non-Assurance 16 households. And they were able to see whether Assurance 16 actually impacted the rate of crisis assistance applications. So when you look at this chart or a chart like this, the first thing you think is, well, I've already got an Assurance 16 program. We've been doing it for years. And so I don't need to do this. But in reality, this is even more useful for folks who have an established program. We talk to a lot of grantees who have inherited programs from previous administrations or who have just been doing things the same way for a really long time and they're not even quite sure how it started. And so taking a simple table like this and actually just charting out what you're currently doing will help you really quickly see whether or not you actually have a goal for your program and you have a way that you're measuring that goal and something that you want to see. Next slide. So planning is one thing, but we all know that you can have pretty tables and logic models, but actually collecting and reporting the data is kind of where the rubber meets the road. And so there are a few things to keep into consideration or keep in mind as you're thinking about how to report and collect data. First, what specific data elements will be collected? If you look back at that table, what are the key, you kind of have to work backwards and say, what are the things we would need to know in order to report on these key outputs, outcomes, and impacts? And then there's the question of who's responsible for collecting each data element. For example, if you look at our previous chart, local agencies might be responsible for tracking who submits an application, who they assist, who signs a contract, but then the state might be responsible for administering client surveys or for obtaining consumption data from utilities. And so there may be a mix of who's responsible for submitting data based on who has easier access to it. What system will be used to collect the data? Some states are really, and territories and tribes are really on top of things, and they've integrated Assurance 16 data collection right in with their existing LIHEAP systems. Others who may be either starting out or not quite sure yet what's going on, they may be collecting it in Access or Excel even, as long as there's a way to collect it that is uniform and meaningful and giving you the data that you need. And then finally, how will data be reported? So if local agencies are administering, how often do local agencies need to provide this data to the state or the tribe or the territory? And so this is where sub-grantee agreements come in handy, making sure there's a clear understanding of what data is required to submit and when. So we've only talked about evaluation. We could spend multiple webinars and training sessions talking about this, but my hope is that today we just gave you a taste of kind of the way that you can begin looking at this and maybe some motivation to kind of go back and look at your own program and consider your goals and the way that you're tracking progress towards those goals. There's a link at the bottom of the slide that will take you to a full presentation on the evaluation of Assurance 16 programs. And my contact information is available at the end of the slide deck if you would like to contact me or talk about any of this. I'm grateful for all of the work that you all do and for the chance to talk with you today. And now I'm going to turn it back over to Jody. Thanks so much.
Thank you, Melissa. Thank you very much for that presentation. We apologize for some of the technical difficulties we've had with the polling, and this will be our final polling question today. And I know that it may or may not be visible to some of you, but for those of you who can see the poll, The question is, are there that was our previous question. I believe we've completed all our polling questions, so we're going to move on to the next section. Joji?
Sorry, Vicky and I will just read two of the question in the interest of time. Vicky?
Sure, thanks, Joji. As she mentioned, we're getting really close to time. So if you are able to access the question and answers box, and I think everyone is, you'll see that as we've been moving throughout the presentation, Akam and Joji were both very diligent in responding to the questions that were entered there. And I will also say that if anything, any questions kind of pop up in your minds after we're done, you're always welcome to reach out to our office. Their contact information will be forthcoming in the next few slides, but I'm sure you all have our contact information anyway, but we're more than happy to chat in more detail and more specifically about your programs if you have any specific questions after the presentation. So what we're going to do now is we've identified just two that I'm going to kind of highlight. And again, if you're interested, you should take a look at that Q&A option that you have down below to see the responses to the others. But first, I wanted to just highlight the question. I believe it came from Brian Sarenson. He's asking, are you saying that they can use Assurance 16 funds for case management that is non-energy related? Actually, that was not Brian Sarenson, that was Rita Gonzalez Garza. And Joji responded to this question. Akam, please feel free. I'm going to read her response, but if there's anything that you want to add, then please jump in. Joji's response was that the case management that Assurance 16's funds is limited to LIHEAP energy assistance related activities only. And then she just said that we would discuss it a little further as the presentation went on. Hopefully that was responsive enough to you, Rita. But again, if you'd like more detail, then please reach out. I'll also highlight the question. This one is from Brian Sarenson. He goes on to say, if that's the case, we also need to discuss how Assurance 16 funds fit into the 15% max allowed. Are they included in the 15% or are they in addition to the 15%? And in response to that, Akam provided a little clarification to say that the Assurance 16 cap is set at 5%. And that's based on all your federal LIHEAP resources available in the given fiscal year. The 5% funding for Assurance 16 is not a part of the 15% cap for LIHEAP weatherization, and that's 15% without a waiver, or up to 25% with a waiver. So the 5% for Assurance 16 is not included. They're two separate pots of money, right, that come from your budget. You can use 5% for Assurance 16, and you can use 15% for weatherization, up to 25% with a waiver. And so those are the ones we wanted to highlight for you all. I also noticed in the chat box that there was a message from, I think it was Trisha Winnett. She was asking for some information from her colleagues. Trisha Winnett mentions that she is new to LIHEAP and would like to ask if anyone has any energy pamphlets or verbiage that she can use to help with her outreach materials for her clients. And so it's Trista, not Trisha, I apologize. So Trista, I would encourage you to reach out to our office and also to feel free to reach out to some of your other colleagues and other state and or tribal offices. And Akam has raised his hand, so I'll welcome Akam to unmute himself and go ahead and chime in.
Sure. Thank you, Vicky. Just wanted to just add a little bit of clarification for everyone. One is Jody did answer that question correctly. However, we have seen examples in the field where Assurance 16 is funded as part of a local agency's larger case management program where they braid funding from other federal resources. CSBG would probably be one good example. That is allowable as long as funding and associated activities are tracked separately. For example, energy-related case management is attributed to Assurance 16 funding, and if there are other family development program related activities to the same household, it's possible, is tracked separately from other funding sources. So yes, the answer is correct, but we have seen variations of it. And then just to add to my answer to Brian's question, it's actually a very good question. And I just wanted to remind everyone that last year when we issued the CARES Act funding, we reminded every grantees to look at their overall funding availability, because with the supplemental funding, everyone's total resources available for a given year has increased. So everyone has a new 5%, everyone has a new 15%. So I just wanted to add that, if grantees have unobligated funds from ARP that is being used this fiscal year, in fiscal year 2022, grantees have an opportunity to look at the Assurance 16 5% max, admin, and weatherization max using whatever resources available in this fiscal year.
Thank you, Akam. And we got another question that I think is a really good one to bring to everyone's attention. It came from Teresa Cullen in Colorado, and she's asking, is Assurance 16 considered admin or program cost?
You want me to take that?
Yes, please.
Sure. Neither. Assurance 16, it's a separate earmarking item. So admin and program. So, we have different earmarking caps. So for example, the 10% overall admin is applied to the total resources available in a given fiscal year. And Assurance 16 is, again, another cap. It's a separate cap. It is not for administrative purposes. It is used, as Kate mentioned in her presentation, staff salaries can be paid out of Assurance 16 if their time is used for case management or Assurance 16 related activities, but it is not part of the 10% admin cap. It's a separate earmarking cap of up to 5% of the total resources available. Like federal resources, I must say.
Excellent. Thank you, Akam. And I think at this time, I'll go ahead and hand it over to Joji to close this out. But before I do, I just want to highlight a message from Heather Jones in the chat box. Heather was sending us a reminder of the upcoming training and technical assistance for the quarterly performance and management reporting requirements. And so that information is on our website. The date for that is March 29th. So I just wanted to highlight that for everyone to hear. And now Joji can close us out. Thank you.
Thank you, Vicky. So the last two slides that you will see here are the resources and references that you could use to develop your Assurance 16 activities. And we will make this PowerPoint available to all of you, even in YouTube. So as soon as we clear this out, we will be able to send this to you. And for any question, please call or email your regional liaison, which should be at the last slide. We have added here the contact information of the DEA operations staff and presenters for this afternoon if you have any question. Last, thank you for everyone for staying with us. You are all highly appreciated and the work that you do. I also thank my colleagues at the Division of Energy Assistance and our grantee and contractor presenters for this afternoon for helping us complete this webinar for this period. We all hope you learn additional approaches so you can plan and implement your Assurance 16. And lastly, for the last 1 minute, I just would like to make an official announcement. This week is my last day at the federal office, so I'm retiring. And for my grantees in regions 2, 4, and 9 and other regions that I have handled, I really would like to thank them for helping me out during my federal stint and being responsive and being proactive in whatever you're doing. And rest assured, you will be taken care of by our by my colleagues at the DEA. I think Akam wants to say his last word.
Georgie, I was going to use the clap feature to really congratulate you on your really nice, dedicated federal career. You have been quite a valuable resource to the LIHEAP, and I'm pretty sure our grantees will echo that with me. Congratulations and happy retirement, Georgie. Thank you so much.
Thank you, everyone, and have a safe weekend. I know it's only like Monday. Thank you and have a nice evening.